So I am going to start by sharing my screen, and then we'll do some introductions. Okay. Hopefully everyone can see my screen. If you could throw up a thumbs up or something, if you can see the slide that says coordinated entry on it. Great, I see some thumbs going up. So welcome to today's training. My name is Allison Del Calzo Behrens. I am the chair of the Morris County Continuum of Care Executive Committee, and I also lead the Coordinated Entry Leadership Team. We have with us today Candy Brewster, who's the director of the HMIS division for the New Jersey Housing Mortgage Finance Association, or HMFA is normally how I refer to it. So thank you so much for being here today, Candy. What we're going to do is I'm going to move through some slides, just going over the two new policies that are going to be effective July 1st. These were approved by the executive committee at the end of 2023 in November. It was determined that we would alert agencies about these changes in the policies and give sort of a turnaround time of 6 months to prepare for agencies to prepare for those changes. So this training is to kind of go over what is going to be taking place starting next week, almost a little over a week away, in terms of the expectations for agencies and for people who are attending coordinated entry meeting. So the coordinated entry prioritization and accountability standards is one of the two new policies. It's always been really, prioritization has always been a key tenet of coordinated entry. This is actually not a new idea, more just a new policy to make sure that we are to make sure that we have a system that is providing an accountability mechanism for the prioritization standard. So the Morris County COC has embraced the philosophy of maintaining a homeless service system that is low barrier and trauma informed. The coordinated entry system includes assessment tools and wait lists to standardize and manage the prioritization of housing service placement based on consumer vulnerability and consumer choice. For some reason, there's like a missing section of this slide that didn't show up in the I wonder if no, okay. I'm not sure why that's missing. It really is not, it's, what this should say is responsibilities of the COC partner organization, the MOU partner organization. That's what it should say. I'm not sure why it disappeared. But those last 4 bullet points should be underneath that heading. So MOU partner organizations should be reflecting this policy within their own policies and procedures. They should be ensuring staff training in the Housing First philosophy and HMIS procedures that are aligned with coordinated entry and moving people through the programs correctly. Accepting program participants based on their prioritization score and documenting any reasons for referral denials for COC funded projects. Program manager responsibilities are to make the referrals through HMIS or the comparable system in accordance with preferences and prioritization score, and to submit quarterly reporting to the leadership team to document project admissions and denials. The leadership team responsibilities are to review and evaluate the data and the reporting that is being submitted, to hold partner organizations accountable to the COC policies and procedures, and to review barriers and trends to improve service provision and performance measures. The case conferencing team responsibilities is to establish a clear process for reviewing those prioritization lists and determining placements. The allocation committee is responsible for reviewing and monitoring the program performance for all COC funded projects. And that does include if projects are not adhering to the prioritization and accountability standards. For instance, denying program participants who are eligible for the project based on criteria other than their vulnerability score without clear justification, that could be included in the monitoring. And then what about COC non-funded project or non-COC funded projects? So that might be projects, for example, who are funded through ESG, possibly home, right? Like other projects that are not funded through the COC. Obviously, our COC allocation committee has no bearing over those. However, anything that is a cause for concern will be reported to the appropriate funding sources for inclusion in those monitoring procedures. That's for any projects that are required by their funder to participate in the coordinated entry system. They aren't all required, although we have seen that more and more projects are being required to follow coordinated entry policies and procedures. So that's the first policy. The second one is the CE events data entry standards, and after which we're going to have a more in-depth on how to do that, what that looks like in HMIS. So essentially, HUD has established requirements for tracking and reporting outcomes for CE participants, and HUD has asked communities like ours to develop a collaborative approach to using CE data to strengthen the crisis response systems in more strategic, impactful ways. So under this policy, the responsibilities of the MOU partner organizations are to ensure that at least one staff member is dedicated to entering CE event data into HMIS regularly, to include CE data elements in their own data entry and evaluation policies and procedures to determine levels of staff, timelines, right? Like how frequently data should be entered, things like that, other criteria, and also in line with the data governance policies and procedures. Ensure training and evaluation of the designated staff, and specifically victim services providers, of which in our community, it's JBWS, should adhere to confidentiality guidelines to use HMIS comparable, an HMIS comparable module to collect and report aggregate de-identified data and outcomes. Responsibilities of program staff are to utilize the CE events data element to document referrals and referral resolutions, also called outcomes. And CE events and outcomes are expected to be documented at client discharge, including when the client's auto discharge. So we should be making those, recording those events and outcomes throughout the household's sort of life in the project. The CE Leadership Committee's responsibilities are to review and evaluate the CE event data to determine the effectiveness of our coordinated entry system. So that's it. That's an overview of the two new policies. Does anybody have any questions? This is a good time. I don't see any questions in the chat box. But feel free to take yourself off mute if you do have any questions. Okay, great. Thank you so much. So now I'd like to turn it over to Candy. Candy, thank you for being with us today.
Good morning.
I stopped sharing, so you should be able to take over the controls if you're ready.
Okay, thanks. Good morning, everyone. I just wanted to reiterate and kind of add a little bit to what Allison said about the coordinated entry process. At this, as Allison mentioned, the COC leads are obviously concerned with primarily COC funded programs, but your coordinated entry and your continuum is everyone who is participating. It's not just the COC funded projects. And in fact, there is a requirement for anyone who receives ESG, as an example, Emergency Solutions Grant funding, VA funding for homeless prevention and rapid rehousing, runaway and homeless youth programs, et cetera, all required at the federal level to participate in coordinated entry. So it gets confusing, but the expectation is that everyone who is a member of the continuum of care is participating in some way in coordinated entry. And even if you are a provider who does not enter data directly into HMIS, if you are making referrals both with consumers that you're working with, both to housing or non-housing types of programs that are going to help to resolve someone's homelessness or imminent risk of homelessness, you can work with other providers who are in HMIS to record those events in some way, because what you want to look at as a community and what the federal government wants to look at is that there is broad participation in the coordinated entry process, that there is real activity going on at the consumer level for the amount of time that they are involved with your prioritization system. So the events are meant to record, as I said, both housing and non-housing events, and can capture virtually anything. So if someone is on the prioritization list and a referral gets made to, I don't know, get some clothing somewhere, or a checkup, or any of those kinds of things that aren't directly housing, resolutions can still be recorded so that your system is showing that things are happening for this consumer. They're not just sitting on a list waiting for, an opening in a housing program, because as we all know, and that as the federal government is well aware, there aren't enough resources to house everybody. And so there has to be a process of working towards housing everyone, some kind of recording of how long that's taking and what's happening along the way before that person gets housed, if that makes any sense. So I wanted to show just briefly for the folks who are in HMIS and working with consumers what this means in terms of recording this data. As you know, NJ211 has a coordinated entry grant, and there are two providers that are Family Promise and the Mental Health Association who are subgrantees for the coordinated entry grant, and are actively both an access point and a referral point for folks who end up in coordinated entry. It doesn't mean that they are solely responsible for everyone on that list, or that they have the responsibility to record everything that happens with a consumer. There should be broad participation, and anyone who's working with folks that are part of coordinated entry should be participating in finding a resolution for those consumers. So I'm going to pull up the HMIS just to show you in a training program what this looks like. And let me back up a little bit here. So for those of you who use the system, you should be seeing the home screen in awards that opens up every time you log in to the system. The coordinated entry events and assessments live under services. So as you see, I've selected my program training NJ211 coordinated entry Morris. I've gone into charts. Charts is the area that contains a number of modules, but primarily you are looking at services, individual. I'm seeing a whole big drop down that you may not see because I have, access that's different. So you would select this services individual module, and we're going to send out a tip sheet on this. So I'm just kind of going over it. And then in this drop down are a number of things, but you want to look for forms. And under those forms, you can see that the assessment prioritization tool is in there, which at this point, I think is solely, correct me if I'm wrong, the purview of NJ211. Is that correct, Jackie or Allison? Is there anyone else that's actually using the prioritization tool?
I believe just 211.
Okay. So 211 would, complete the assessment, and that gets recorded. So that's number one for coordinated entry data fields. What happens after that most of the providers on this call will be using or participating with is the coordinated entry event. So when I click on the coordinated entry event, it's going to open another screen and give me a list of consumers who are in my program. So for the sake of today, Gomez Adams is the person that we're going to record an event for. I'm going to hit continue. And you can see here that there's already been a few events recorded for Gomez. He's been in here a long time. He should probably get into housing. But I want to add a new coordinated entry event. And I'm going to say that he is now being referred to a housing disposition. So I'm going to update the coordinated event section. It's going to open up these required fields. I'm going to put the date of the referral in as today's date. And I am now going to refer Gomez to a rapid rehousing opening. Oh, yes, Shannon. Have a question?
Oh, yes, sorry. I didn't realize I put my hand up, but I do have a question. So
Okay.
nobody at our agency has access to forms.
Okay, that's because, and I'm going to get into that in a second. You have to be a participating agency in the coordinated entry. So you still have a program that's directly entering data into HMIS, correct?
We have all of our programs are in
Okay.
MIS, and we're definitely a participating coordinated entry provider.
Right. So
But none of us can see what you're doing now.
okay, well, I'm going to get into that in a second. I'll go through this referral of this coordinated entry event. Then I'm going to go into another section to show you why you're not seeing this. And then we'll come back and review this again. So just to reiterate, I'm going to refer this person now to a rapid rehousing project. And these other boxes are going to open up. And this is if the event type is a referral to emergency shelter, transitional housing, rapid rehousing, or permanent housing, then what program were they referred to? And this drop down should show all the rapid rehousing programs that, this is showing me the whole state, but it's going to show me all the rapid rehousing programs that are recorded as participating in coordinated entry. And then this box will show whether the client accepted it, it was a successful referral, the client rejected it, or the provider rejected it. And that's where the results are recorded. So let me step back here a second. And I'm going to show you what we're working on right now. So when these coordinated entry events and assessments were rolled out last year or the year before, I guess, a new section was added to HMIS that requires agencies to record, and really, it's us at this point that's doing it, whether this particular program is participating in HMIS or not, and whether they are participating in coordinated entry or not. So there is a new section that's called program participation, And when I click on that, again, this is a training program. It opens up a window and it shows me the HMIS, whether they're participating in HMIS, because we do have non-participating programs in the system, and whether this program is participating in coordinated entry. So here, if I open up this record, we can see that they're participating in coordinated entry, whether or not they're participating in coordinated entry, whether they are an access point, or whether they receive referrals, and then what kind of access point they are. So whether they're doing assessments. So for NJ 211, they should be an access point that's doing housing assistance, screening, and referral, and when they started participating in coordinated entry. So at this point in Morris, and Allison and I were talking about this before the training started, we have a list of every project in Morris County, and I just need to go through and add whether that you are participating in coordinated entry and that you are receiving referrals. Right now, NJ 211 is the only agency that is an access point, which means that's where the assessment happens. That's where somebody comes in to coordinated entry. So any other agency that's working with consumers, we will go through and record that you're participating in coordinated entry and that you're receiving referrals. And at that point, Shannon and everyone else, you should be able to go into charts, services individual, and see that form coordinated entry event. So just to walk through that again very quickly, you'll click on coordinated entry event, you'll select your consumer, you'll hit continue, you'll add a new coordinated entry event, update it, and then again, the type of event is going to limit what you see in the dropdown. So if it's a referral to prevention assistance, you should only see the providers that provide prevention. Do this. And for the housing ones, if I'm referring to, as I said, you can record any of these things like prevention. You can do diversion. I know there's several diversion programs. If it's post-placement case management, so they've been referred to a housing program, they've been selected, but there's services attached to them. So you're going to refer to an agency that does case management. And it's pretty self-explanatory, but again, Allison has as always, excellent document that we're going to share with everyone, which break down the types of referrals and what the system means by that. There's non-continuum services, which just basically means that there's all of the programs that are participating in the continuum of care, none of them have availability. And so we're referring to a provider outside of the continuum of care. But you have a very active COC and broad participation at this point. So I don't foresee that you're going to be using this a lot. This referral to non-continuum services ineligible for continuum services basically means you probably won't be using this much either, because it basically means this person's not homeless and they don't need any of these services, right? So I don't know why they would be in there, but that's a possibility. And so each time that a referral is made, that is going to be moving someone closer to finding a permanent solution to their housing crisis, this option, this coordinated entry event, should be recorded. And then at the end of each year, there's a report that's run across the whole continuum that shows how many events were recorded, what the outcomes were, and how well your COC and your coordinated entry process is functioning. So let's see. Allison just put some clarification. I was just going to see if there's any other questions on that. As I said, we're going to go through and make sure that you all are recorded as participating providers who receive referrals and or make referrals, if that makes sense. Any other questions on that, or just of the process in general? It's a quiet group.
You did predict that it would be a quick training, Candy,
Yes, I
so.
did. It's really very simple. So once we get you recorded, which should be today, as participating, you'll see those. And you know, we have, like I said, a tip sheet that I will share with Allison that she can send out to everyone who is on the call today, or people that might not have been able to, that just walks through the steps where you find the forms, et cetera, et cetera. So it's fairly self-explanatory, but it's just, you know, very important in terms of your system-wide performance that these events get recorded, and they can be recorded at Access as well. So Jacqueline's, your team can, if you're making referrals as you're prioritizing folks, those should be recorded also. And I think you're doing that, right? Like the events.
Candy, at the top of the prioritization tool, there's
Mhm.
a section about CE assessment that is kind of like the event. So we should be doing
Yes,
both.
that's recording the assessment, right? Is that the piece you're talking about?
I'm
At
just
the top.
wondering if we should be doing an event for every prioritization tool.
Not unless you're referring them to some other service. Like if you're referring directly to a housing navigator, you know,
Okay.
that can be recorded as an event. If you're referring them to some other provider in the system directly,
Okay.
that should be recorded. Yeah.
Andy, does the agency that's getting the referral receive a notification, or is it rest solely with the person making the referral to follow
Yeah.
up and see what the outcome was?
Yeah, it rests with the person that created the referral. So that's a process conversation that maybe you guys need to have. Like if you're referring to, for example, a permanent housing program, Laura, do you want that housing program to be the one that records that information? Or, you know, I mean, you have to go back in and record the result at some point. So if you're recording the event, on your end, you would leave that result blank until you actually receive the outcome. If you know that, you know, the person's housing ready, you're only referring them, they've been through case conferencing, you're referring to them to this housing program because they're the next person on the prioritization list that's eligible to be housed. The discussions already happened that this person is appropriate for that housing program, et cetera, then you can record all of that at once. So it's really a process conversation that you guys need to have, how you want that to happen. But yeah, it's not the same as, you know, doing an electronic referral through the system. It's just recording the event. Doesn't mean that agency is getting the actual referral. Does that answer your question or just make it more confusing?
No, it makes sense. It sounds like it does need to be a bigger conversation. I'm just thinking about like if Jacqueline's referring people to shelter, that's a lot of people to go back in and try to find out what happened. I don't know.
Yeah. No, I know. I know. And you're not going to capture 100%, but like certainly the housing, the final outcomes should definitely be recorded, right? But you may miss some events along the way, and that's fine. But you want to show as broadly as possible at the end of the year, this is what happened in our coordinated entry system. And we made a lot of referrals and these are the outcomes, but you're right. You're not going to capture every single one. Because, Morris still is one of the few COCs, and perhaps the only one that is prioritizing for shelter. So that kind of adds another layer, because just because a referral is made to shelter doesn't mean the person is going to be accepted into shelter, right? Because these are not emergency, the Morris County programs are not emergency shelter programs that are going to accept somebody at the same time a referral is made, in most cases. Was there another question? I thought I saw somebody.
Yeah, hi, Fiorella Diaz, JBWS. I was just raising my hand because to echo what Laura was saying is that it's a lot of, it would require a lot of coordination, especially since JBWS is not an active participant with HIMIS.
Right.
And so, how we receive and present referrals is something that requires a lot of moving parts. So I'm just curious to see how that's going to function for our agency and how we provide sheltering for our participants. I just wanted to echo what Laura was saying.
Yeah, so you're exactly right. According to the law, like VAWA agencies are prohibited from entering their data directly into the system-wide HMIS, and use a comparable database, as Allison pointed out earlier. But you are participating in coordinated entry, and you are participating, I believe, in the case conferencing, correct?
Right.
So,
but we don't use HIMIS.
right.
Mhm.
But those outcomes can still be captured in HMIS in an aggregate way, the same way that people are put on, 211 assesses folks who may end up getting referred to your agency, to your shelter, using non-identifiable information. And
So the level, I'm sorry, Candy,
go ahead. No, that's fine.
No, so the level of responsibility for entering would fall on the agency that's referring to JBWS.
Yes.
Okay.
Yeah. But at the end of the day, if you are participating in case conferencing and there are folks in your shelter who are now being referred to like a permanent housing program, if they're no longer in need of shelter, if it's deemed that they are safe in the community or whatever the conversation is, then those results can be recorded, those referrals can be recorded. So it's a murky area, and it's just always confusing because there are, as we know, plenty of people in HMIS who are victims of domestic violence. They just don't happen to be in a domestic violence program. So their data is in HMIS unless they're actively fleeing. And, for example, in Newark shelters are filled with people who are victims of domestic violence, and their data is being recorded in the shelter program because the shelter program is not a VAWA agency, right? So, yeah, so it's a very murky area, and it's up to the COC to set the policies on how that's going to be handled, and of course, you as the provider are the final say as to your consumers' data and all of that. Amanda, did you have a question?
I did. So I just have a question in terms of the housing navigator. So I was currently the housing navigator for Family Promise, and I'm on the call with Jack Lee, who will be taking that over.
Okay.
I just wanted to know what the expectation is for the housing navigators to use entry events, just because this is something that I had started a little while ago when Marco was previously in Jacqueline's position, and we were kind of just figuring out how to utilize housing entry events. So as the housing navigator, we really only use the referral to the street outreach project or services, or the referral to housing stability voucher.
Mhm.
However, well, one, we don't really, housing vouchers are obviously hard to come by, so we don't have a lot of our housing navigation clients being referred for housing stability vouchers. So we rarely use that one. And then in terms of the street outreach, a lot of the consumers that we work with are already aware of those services. So even if, even if we say like, stop by the drop-in center at the Family Promise Drop-In Center in Morristown, those are already like referrals that the consumer is familiar with. So we weren't really using those anyway either. So I just wanted to know like what the expectation is for the housing navigators to use them, because I want to still be able to, have the data in. I just don't know exactly how many, are you looking for, for the month or for the quarter, in terms of the housing navigators.
Yeah, and I would say that's really a question for Allison, but I will say that the most important events that need to be recorded are obviously the housing solutions of any kind. And I guess that's an ongoing conversation in terms of, I think standards are just being set right now about who gets referred to, like rapid rehousing, for example. There are a lot of rapid rehousing programs in Morris. Who gets referred to those? How does that happen? Are they being recorded? So as the housing navigators, you're obviously not working with everyone that's in coordinated entry, but among the consumers that you are working with, I would think the expectation is to record more than a referral to street outreach. Do you know what I mean? Or who, I don't know, like Allison, I think that's a question for you or for the executive.
Right, because the housing navigator's role is just to get them voucher ready. So once a client is voucher ready, like once we collect those documents, our work with the consumer is primarily done. Like we are rarely ever referring somebody to like a rapid rehousing opportunity or something like that.
So I think we can talk about this a little bit more offline if we need to. But I think, correct me if I'm wrong, Candy, that the housing navigators and the primary coordinated entry project manager are also access points. So I think that a large part of the those organizations work in coordinated entry events will be related to being an access point, in addition to making referrals when needed or when necessary. So there's sort of that dual role that's happening as well.
Yeah, so just to be clear, though, an access point is really where the assessment takes place. So are the housing navigators doing assessments, or these people have already been assessed? And, right now, the system is automatically discharging consumers from coordinated entry. I think it's 90 days, right, Allison? I mean, right, Jacqueline or Allison, whatever.
90 days is correct.
Right. So the data on those but they may still be on a prioritization list, right? this is where it gets confusing, because the list is not directly tied to the coordinated entry events. Like, we don't necessarily, like, they're not linked, I guess, for lack of a better term. So the way that the report at the end of the year works in the system, and the way that HUD designed it, is that the annual performance report that's completed by the COC across their coordinated entry counts anyone who's had an assessment completed during that, year. And then it counts all the events that are associated with those consumers who had an assessment recorded. So when Jacqueline talked earlier about, there's a small form at the top of the prioritization tool that records that assessment, some COCs have a standard that if someone's been on your prioritization list for over 90 days or over 120 days or whatever it may be, that a new assessment is completed. And I don't know that that's happening at this point with people who are on the list, if they're being reassessed after a certain amount of time and then become active again in what's happening with your coordinated entry. Otherwise, they're just sitting on a list somewhere, and unless that event is recorded or that assessment is redone, they're not counted in your coordinated entry for the year. So
Shannon, you also have your hand
oh,
raised?
sorry, yeah.
Yeah, sorry. I'm just trying to like translate everything that's being said to make sure I understand for my specific agency what's expected of us. So what it sounds like is that you're really just trying to capture like a timeline of what happens with a person starting at the waitlist phase from coordinated entry and then into shelter, and then where they go from there. So for us, like, does that mean that every time we discharge someone from shelter, we would, in addition to processing the discharge and HIMIS, also go into coordinated entry events and list where they went? Is that what I'm understanding?
Well, if you're discharging them from shelter and they're being referred to a housing program or something, what causes a discharge from your shelter? Is there
Yeah,
a
it's
time
almost-
limit? Is it
always a placement into some type of housing.
okay? Yeah, then that would be recorded. Absolutely.
So it's just like another layer we have to
Yes.
incorporate into our procedures, basically.
Yeah, if it's someone that's in coordinated entry, they're still on the list. Now they have resolved their situation. It's showing up in two places, I guess, Shannon. It's showing up because you're collecting that information in your discharge, right? So
Right.
that information then gets pulled into your, system performance measures report and your longitudinal system analysis. But unless but it won't be pulled into coordinated entry unless one of those data elements is completed on them. Does that make any sense? Unless that, you'll still have the positive outcome across your system. But when you run that annual performance report for your coordinated entry, so that you can really look at your coordinated entry and say, do we have the pathways to housing? Are they effective as they can be? What do we need? Which households touch the system and exit the system without any kind of, assistance? That all shows up in coordinated entry. And unless those events are recorded, just because you're recording them in your discharge destination information, that's not going to show up in coordinated entry.
Okay, yeah, that's what it sounded like to me. Thank you. That makes
Yeah,
sense.
sure, that's a great question.
System-wide data and not the data specific for our agency. Thank you.
Correct. Yeah, that's great. Great question. Anything else?
I did have a direct message with a question.
Okay.
I think this goes back to something
Oops.
that was just asked. And the question is, isn't it about outcomes, not timeline?
It's both. It's both, because your outcomes and your system performance, the goal is that, going back to the tenets of COCs and coordinated entries, that, you know, that homelessness should be brief and rare, right? That people, you should be able to show entries into homelessness, the timeline of how long it takes to resolve that homelessness. Yes, the outcome's important, but it's also like if it's taking 4 years to get housed, that's not ideal if they're still experiencing homelessness, right? So the system measures both of those things, with the goal being that someone, the goal for everybody should be that homelessness is brief. We know that that's not true right now, because there's just not enough resources nationally, let alone in New Jersey, to resolve everybody's housing crisis. But yeah, you're really looking, the timeline is part of your outcome, I guess.
Candy, thank you. I was on the phone with some others yesterday that couldn't be here today. And I want to make sure I ask the question. I think you already kind of went over it a little bit, but what's the difference? And this is kind of all related to similar to the questions that have been happening more recently. So what's the difference between making a referral and recording one as an event? Because you can still make a referral that can be accepted, right, by another organization. And then you'd also do the event recording.
Right. They're two totally separate things, right? It's just recording those referrals. So again, it's a COC kind of decision. How many of those non-housing events do you want to record? Like, do you want to record any referral to, any kind of program, like a services only program? So 211 may be recording those referrals to a housing navigation project, but they may also be referring to emergency assistance, financial emergency assistance, flex funds, furniture, all of that kind of stuff. At this point, I think you're still in the early stages of also prioritizing prevention services, right? But those can be recorded as well at some point. Like, are you diverting people from actually being, homeless? But at this point, I think that the really important referrals are, referrals to shelter, transitional housing, rapid rehousing, permanent housing, or other things. A referral to, an open Section 8 waiting list or housing choice voucher, those kinds of things. So I don't know if that answers your question. The ability to record any kind of referral is already, baked into HMIS, but these coordinated entry events should just be for folks who are in coordinated entry, which at this point would be people who are literally experiencing homelessness, and referrals that are matching them to housing opportunities or getting them ready for housing opportunities. Does that answer your question? I don't know.
Yes, thank you. Were there any other questions before we finish up? Great. Well, I would like to thank everybody for your time today. Thank you, Candy, for joining us and walking us
course.
through that. Very useful. After today, we'll be updating the participation for all the different projects.
It should be
It-
available today, and then we'll follow up with tip sheet, and
Right.
you and I can go over those other referral types.
So enjoy the rest of your day. Happy Juneteenth.
Yes.
I know some are celebrating today and some are celebrating on Friday, so whatever those celebrations look like for you, I hope you have a blessed time of it. And that concludes our training. Have a great day, everybody.
Thank you, you too.
Thanks, everyone.
Thank you. Bye.
Bye.